Dr. Vito, I'm here for a follow up for my hip surgery. I'm supposed to be seeing Dr. Illy Fields.
Okay. Give me 1 second. I'll be right back to you, man. And your name is Adele, right?
Yes, Adele Dimple.
All right. Can you have a seat for me, Miss Adele Dimple? I'll go give them a heads up that you're here. So just give me
Yeah,
1 second, okay?
I can stay right over here.
All right. Thank you, ma'am. Knock on the door. Doom, 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 doom. Dr. Fields, Dr. Hunter, your 5 o'clock appointment is here.
All right, perfect. You can send her in.
Miss Adele, they'll have you now. Just follow me this way. Here you go, ma'am. Just have a seat on that couch.
All right, Adele. The last time I saw you, we had surgery and open reduction and internal fixation of that left hip. How have you been feeling since surgery, ma'am?
It's been doing really good. There's just some days like the pain is a little bit, and I just, take a couple ibuprofen and go on. It's not really been that bad.
Okay, and speaking of medication, what medication are you currently taking and when was the last time you took it?
The only thing I've took is ibuprofen, and I probably took it yesterday morning.
Okay, so we are not taking the oxycodone anymore, correct?
No, I stopped that probably a week after the surgery.
Oh, good, okay. And on a scale of 1 to 10, how would you rate your pain?
I say 0 out of 10, but there's some days it's like 2 or 3 out of 10.
All right, good to hear. That's definitely an improvement. Last time I saw you, we went from an 11 out of 10 to a 6 out of 10 the day of surgery, so I'll take that. All right, so I'll have a couple questions for you. Have you noticed any pus or drainage from your incision site?
No, I've tried my best to keep it as clean as possible.
Good. And no swelling, no redness.
No, not that I've noticed.
Good. And although you said that some days are a little worse than others, how is your range of motion? Have you been able to walk okay? Are you still using the walker? When was the last time you used that walker?
I probably stopped using the walker 2 weeks ago.
Good. I'm glad you're walking on your own. Okay, so I will have Dr. Hunter here. He's going to take your vitals and then we'll probably do a quick lab draw. I just want to make sure that your white blood cell count is normal, it's not elevated, and that we're not showing any signs of infection, dear.
Okay.
Hello, I'm Dr. Hunter Dimple. I will be the assistant today. I'm going to go ahead and get your vitals.
Hi, Hunter. Yeah, okay.
Okay, so the first thing I'm going to get is your. Okay, I'm going to get your blood pressure real quick. And, all right, Ellie, her temperature is 98, blood pressure is 117 over 72.
So, Adele, your vitals were within normal limits, exactly what I would like to see. I'm going to have Dr. Hunter here draw your labs and then I'm going to test them. We're just looking for the main thing is white blood cell count. I want to make sure that there's no infection, like I said, and we are good to proceed with our physical exam.
Okay.
All right, are you afraid of needles?
No, not at all.
All right, I'm going to go ahead and draw your blood for labs. All right, I got that. Let me just put a bandage on it.
All right, dear, this will just take a second. Let me go test these labs for you.
Adele, can I get you a glass of water or anything?
No, I'm all right.
Would you like a lollipop or chocolate chip cookie? Anything, ma'am?
No, I'm good. I just had lunch not that long ago.
All right, dear, I'm liking what I'm seeing. No signs of infection. Your white blood cell count is within normal limits. So what I'm going to do is I'm going to prep for my physical exam, and I'm going to check that incision site. Can you please lay down on the table for me? Okay, perfect. So you know how this kind of goes. I'm going to be checking a couple things here. Like your pain, range of motion, deformity, swelling. If anything hurts, just give me a holler and I'll stop where I'm at. All right, perfect. Range of motion and stability is not impaired. I'm going to go ahead and take a look at this incision site. Perfect. I see no drainage, no swelling, no redness. All right, so with that being said, so far so good. I just want to take a quick x-ray here. We need to just make sure that your bones are in alignment, the hardware is positioned correctly, there's a good fracture healing and no signs of complication. So if you can, just try and sit still for me. I'm going to have Hunter here turn on our equipment and we'll proceed with this x-ray.
Okay, it's on.
Thank you, thank you. All right, let's try and reposition the patient. Okay, I'm going to run these images one more time. All right, let me just take a couple
I told
minutes.
you
I'm
don't
going
be
to look at
playing
these
on this
images for
machine.
you. All right, perfect. So, what I am seeing here is perfect bone alignment. The hardware is positioned correctly. Pins and screws are still in place, and it's created beautiful fracture healing. There is no signs of complication, no swelling, nothing that I'm seeing on imaging here. So, dear, are you ready to get these sutures removed?
Yes,
All
ma'am.
right, so just lay back on the table for me. Hunter, can you hand me the equipment, please? This shouldn't hurt at all. Should be pretty pain-free. Again, if it does, just give me a holler. I'm going to put on my gloves and then I'll remove these sutures for you. Perfect. All right, Hunter, will you discard the trash for me, please? Okay, Adele, you can have a seat again. So basically, this is a best case scenario, post-operative. This is beautiful healing. Your hardware is positioned correctly, no signs of infection, no signs of complication, and the suture removal was a success. With that being said, I'm going to lift your activity restrictions. No walker. I don't mind if you are weight bearing. I would like for you to continue walking as normal. I will send you home with some ibuprofen. That seems to be helping your pain. It's remained low, so I don't think that we need to give you anything higher. Are you okay going home with ibuprofen?
Yes, ma'am, that's
All
fine.
right, dear. So I don't see a need for you to have to follow up, but please come back in. If there's any swelling, if there's any redness, if range of motion is giving you a hard time, anything of that matter, I'd like to see you immediately.
Okay.
Any questions for me while Hunter types in, get your discharge paperwork to you?
No, I don't think so.
All right, perfect.
All right, here's your discharge papers. Are you going to be paying with insurance or a debit or credit card?
I'll pay with insurance.
Okay, just give me 1 second.
Try wiping it off. Try wiping it off. Blow on it. Work like a charm.
All right, and here's your insurance card back.
All right, dear. Just give us a call if you have any troubles or any exacerbating symptoms. Until then, I hope that you have a good day, a good week, and that everything with that hip is starting to move correctly and work for you.
Thank you
You're
all.
welcome, dear.